Good day everyone, my name is Jeffrey C. Consuegra and I am from BSN 12A. Now I'll be going to perform hand washing. So first, I'll be going to check for the completeness of the supply to ensure that all of the necessary equipments or materials are prepared. So I have here the liquid soap and also the clean tissue. So now I'll be going to stand in front of the sink with the uniform not touching the sink where most of the microorganisms or contaminants accumulates. Next, I'll be going to remove all of my jewelries, including my wristwatch and also my ID lace. Where most of microorganisms intact or inhabited. Next, I'll be going to turn on the faucet and adjust its force. This is to prevent splashing any contaminants or microorganisms all throughout the surroundings. So after that, I'll be going to wet my hands from the wrist area towards the fingers, pointing it towards the bottom of the sink and ensuring that my hands will be above elbows at all times. To allow water flow from clean to dirty areas. So next, I'll be going to inspect the conditions of my cuticle, if there are any open lesions, abrasions, or cuts. These to detect from any wounds that infection sources acquires. So next, with a bar or liquid soap, lather the hand thoroughly. Since soap emulsifies fats and debris. Wash the hands for about 15 to 20 seconds with firm rubbing and circular motion and rub palm to palm. Since physical friction removes physical debris from my hands. Interlace fingers and rub palm using the back of the hand for at least 5 times each. This to ensure to clean spaces between my fingers. And now I'll be going to rub palm to palm with fingers interlaced to ensure thorough cleaning of the remaining parts of surfaces. Next is I will be going to rub the back of the fingers to the opposing palm with the fingers interlocked. This to remove dirt from the back of the fingers and also the knuckles. I'll be going to rub each thumb clasped with the opposing hand with the rotational movement and vice versa. Rotational rubbing backwards. This helps to remove any debris that always proceed in the thumb. So now I'll be going to rubbing backward and forward with the clasped fingers of the right hand to the opposing thumb with forward and backward circular movement. This cleans fingertips and under nails. Rub each opposite wrist. To ensure that all microorganisms eliminated from my hands. And now, I'll be going to rinse my hands with water and check or inspect if there are remaining dirt or any debris. This is to prevent skin irritation and recontamination. So now I'll be going to dry my hands from fingers to wrist using the clean tissue. This is to dry from the cleanest and to the dirtiest area. So now I'll be going to turn up the faucet with the clean tissue, since this is to reduce decontamination after hand washing. First, I will be going to perform thorough hand washing or hand hygiene. Removes the dirt. It will remove the dirt and microorganisms to maintain asepsis. So, before that, I will be going to remove also my jewelries, including my wristwatch and the ID links. Now, I'll be going to prepare the sterile gloves, ensuring the correct size, and inspect for tears, stains, and tears. This prevents contamination and ensure gloves integrity. So next, I'll be going to remove the outer wrapper of the glove package by carefully separating and peeling apart sides. This maintains sterility of the inner package So now I'm going to grasp the inner package. And lay it on a clean, dry, flat surface within waist level area. This will keep the glove sterile and ensures that it is within the sterile field. After this, I'll be going to identify the left and right glove, and then glove the dominant hand first. In choosing the correct glove placement, it can ease the glove donning. So with the thumb and the first two fingers of the non-dominant hand, I'll be going to grasp the cuff of the glove of the dominant hand, touching only the inside surface only to prevent spread of contamination of the outer surface, which is sterile. So now I'm going to carefully pull glove over my dominant hand, leaving the cuff without ruling the wrist, ensuring that the thumb and the fingers are in proper spaces. This is to maintain sterility and proper placement. Next, I'll be going with the glove of the dominant hand. I'll be going to slip my fingers underneath the cuff of the second glove. This to avoid contamination by touching only the sterile surface. And I will be going to carefully pull the second glove over the non-dominant hand, keeping the dominant hand's thumb abducted back to prevent gloves contamination during the donning. After this, after the second glove is on, wait. So after the second glove is on, I'm going to interlock fingers and hold it away from my body above waist level area until the procedure begins. But before that, I'll be going to arrange the spaces to fit in to the right fingers or any crutches. So, I'll be going to interlock my fingers and hold it away from my body. This to keep above waist level. This is to maintain sterility until it is used in any procedures. So now, assuming that we're done with the procedure, I'll be going to decuff the gloves. So now I'll be going to grasp the outside surface of one cuff with the other gloved hand without touching the wrist. I'm going to pull it halfway down. So this will begin with safe glove removal without contaminating. So I'm going to take the half of ungloved hand and place it under half of the other glove and prepares for the inside out remover for any contaminants. So I'm going to pull glove off, turn it inside out and discard in receptacle. And this prevents spread of contaminants or any contamination. And I'm going to take the fingers or the bare hand into the and tuck it inside the remaining glove cuff, and I'll be going to peel off inside out and discard it into the receptacle. Fully contains contaminants and dispose it safely. Next, lastly, is to perform hand hygiene. And this will remove any contaminants and, that transfers during glove removals. Now, I will be going to perform the Leopold's maneuver. So first and foremost, I will be going to perform hand washing. This to deter microorganisms and other infections that causes diseases. So assuming that I am performing hand washing. So now I'll be going to explain to the patient the whole procedure. Good morning, ma'am. My name is Jeffrey Sigala, and I am your student nurse for today. So, ma'am, may I have your nickname? May I have your name and also your birthday? Okay, thank you so much, ma'am. So, ma'am, I'll be going to perform a Leopold's maneuver, which includes gently palpating on your abdomen to determine the position of your baby inside your womb. And also, I'll be going to use my stethoscope to determine the fetal heart tone of your baby, if it is normal or if there are any other symptoms. So next, I'll be going to ask the client to empty her bladder. So, ma'am, can you please empty your bladder? And if you're done already, kindly remain. This will help provide comfort to the patient, and also to get the result of the position of the baby or any procedures accurate. So next, I'll be going to assist the client in a proper position. So I'll be going to position the client in a supine position. And I'll be going to offer one pillow at the back of the head to ensure comfort. And also to ask the patient to slightly flex the knees. Okay, ma'am, can you please flex the knees to ensure that there are no abdominal muscle strains during the procedure. And I'll be going also to provide a rolled towel to her back to help support, so that there are no she will not experience supine hypotension syndrome. Okay, so now I'll be going to expose the part where I'll be going to assess. So next, I'll be going to stand in front in the right side of the patient, since I am right-handed or my dominant hand is right, to ensure that I'll be going to palpate it comfortably, and also to avoid any interference during the procedure. So now I'll be going to perform the first maneuver, which is the fundal grip, which will determine whether of the parts of the fetus is in the upper part of the uterus or abdomen. So with a gentle grip. If you are palpating, if you feel when you're palpating a soft, irregular nodules, so that means that the part of the fetus that is in the upper uterus is the buttocks. If you feel hard or circular or round, it is a head of the fetus. So next, I'll be going to perform the second maneuver, which is the umbilical grip. So what I'm going to do is I'm going to use both of my hands in both sides of the abdomen, and I'll be going to determine if which side does the fetal back or the fetal extremities position. So if you can feel that there are long and firm, long, smooth, and continuous object or parts inside, it is the fetal back. But if you feel that there are irregular nodules, it is the extremities of the fetus. So next, I'll be going to perform the third maneuver, which is the Poltics grip. So what I'm going to do is I'm going to use my thumb and my fingers into the uterine segment just above the symphysis pubis. So I'll be going to grasp it and move it side by side to determine which part is the presenting part of the fetus is in the pelvic, and also this will include determining if the fetus is engaged or floating. So if it is not movable during the movement, so it means that the fetus is engaged, or the mother is ready for delivery within probably within the week. So next, I'll be going to perform the fourth maneuver. I'll be going to face to the patient's feet, and I'll be going to palpate the lower uterine into the pelvic, into the center of the pelvis. This will determine the cephalic prominence and also determine the fetal attitude, if it is flexed or extended. So now I'll be going to detect or auscultate I'm going to locate the fetal heart rate of the fetus or the baby. So I'm going to use my stethoscope. And locate using my one hand, turning on the bell, which is appropriate in hearing low pitch sounds. So since the position of the baby is in the left side, the fetal back of the baby is in the left side, and the presentation is cephalic, I'll be going to auscultate it in the left lower quadrant. So after that, I'll be going to count for the fetal heart rate for full 1 minute. So as if that I am done with 1 full minute, so I'll be going to note the location, the character, and the rate of the fetal heart tone. So it is regular, which is in a range of 120 to 160. So the fetal heart tone of the baby is 145 beats per minute, which is normal. And also it is regular, and there are no irregular tones that I heard or auscultated. So next is I'll be going to make the patient comfortable. So I'll be going to turning the drape back or the shirt back. So ma'am, I am done with the assessment. So can you please feel comfortable? So this will help the client to continue trusting the healthcare providers and also to maintain the dignity. So now I'll be going to document for the um, document for the status of the baby inside the womb, including the presentation, the lie, the if it is engaged or not, or floating, and also the fetal attitude. So, we're going to record it or document it. So, the presentation of the baby is cephalic, and the position inside the womb is into the left, occiput anterior, and the attitude is the baby is flexed, which is the chin to chest, and the engagement during the palpation is the baby is engaged, not floating, and the fetal heart tone is 145 beats per minute.